Okay, this is a great question. Dax says, can you explain why you would trust the O2 sat in general instead of assessing the client? So this was a question asking how, you'd best assess the respiratory status of a patient. And the choices were, to look at the rise and fall of the chest or to see how they talk or maybe to look at their color, something like that. I don't remember exactly what the options were. And the correct option was to look at the O2 sat. And the reason the O2 sat is correct, the O2 sat is going to tell you how much perfusion is happening, right? So you look at the patient's rise and fall of the chest, you can count the respiration. The respiration is supposed to be 12 to 22 or 24, depending on the book that you're using. But all that tells you is if they're respirations are within the therapeutic range. But a patient can be, their respirations could be at 14, but the O2 sat is at 91. Right? So that really the rise and fall of the chest or the count of the respirations or even the patient's color will not be as significant as the O2 sat because we know once the O2 sat hits at 91% or lower, we know that patient's in respiratory distress. There is no question about it, right? But you can look at the patient's color and the patient may be pink and they're still in respiratory distress. Or you count the respirations or the respirations are still within the normal level and there's not enough perfusion going on. So that's why you look at the O2 sat. Something else I want to bring to your attention, guess what? Checking the O2 sat is still an assessment. As a nursing student, this is a common mistake, so I'm not picking on you. This is a common mistake. Many students tend to think of an assessment as a physical examination of the patient. That is not your only form of assessment. Anything that you do to get information is an assessment. That means you looking at that O2 sat, that's an assessment. You going into the patient's chart to get information, to look at a med, to see what the patient's history, that's an assessment, right? Anything you do to get information is considered assessment, including looking at the O2 sat, also known as the oxygen saturation rate.